Live from San Diego, this is the Fox 5 News at 4.
A group aimed at protecting healthcare workers at local hospitals is making some progress in its early goals. The San Diego Workforce Violence Task Force was formed just a few months ago by the San Diego County District Attorney's Office and Scripps Health.
Its members include dozens of hospitals and agencies across the county. And joining us now with more on this initiative and its progress is San Diego County DA Summer Stephan. DA Stephan, thank you for coming in. We appreciate you coming here to the Fox 5 News.
Good to be with you on this important topic.
It is an important topic. And, you know, Andrew and I were talking about it earlier. We didn't realize that it was such a problem. Why was this task force formed?
Because there is a large national problem. It's affecting nurses and doctors. They're feeling like they're working in a war zone when it's supposed to be a place that is stressful because they're dealing with life and death and the health of individuals. But now they're looking over their shoulder. People are just lashing out, taking out all their worries and problems on these amazing people that are trying to save lives. And so this task force came together to really track the numbers and develop strategies on how we push back.
Do we have a lot of cases of doctors, nurses, and people in the medical field being targeted that we had to start this task force?
You know, you'd be amazed. So we've seen across the nation that at least a rise of 30% in violence just in the last year. And in San Diego, we wanted to have a better way to track it. So since all of the felony cases come to the DA's office from across the county, all the hospitals, we began tracking in December when we formed the task force. And we have 39 cases.
Was there something that set it off? Was it COVID? Was there something that changed people's mentality when it comes to the medical field?
I mean, I'm sure COVID and being impatient is a part of it, but I think there's almost a feeling like there's no accountability, like people can just lash out, and you don't see that. For example, as soon as you saw it in the flights, in the attacking people who are on flights, they face felony charges immediately. Even saying something threatening, they face consequences. But unfortunately, in the health field, unless you produce great bodily injury, you're facing a misdemeanor. So part of our strategy is to also have the law reflect our values, that when you're in a hospital, what is a doctor or nurse supposed to do? They can't leave their patients and run away to protect themselves. They have to stand their ground and be there for their patients. So it makes it much harder, much more stressful. I mean, 3 recent convictions, a nurse was bit, with all the potential for diseases. Another one, her life was threatened, her family's life was threatened. I mean, this is just unacceptable. And I think the message the task force is sending is we're gonna fight for our health systems to be safe. I can't talk about a pending case, but obviously the ultimate harm we're worried about is something that happened recently with the dentist that was murdered, and again, it was a patient just lashing out in the worst possible way with deadly consequences.
So you're hoping that with this, you can at some point change the laws to be the consequences to be more serious, really?
That's right. We want a threat, just like in airports. When you threaten in a vulnerable location, a healthcare location, there needs to be better consequences. Pushing, shoving, you don't have to wait till there's blood. Someone who's trying to save lives there should have better consequences. And the other thing is we want to encourage the healthcare system, which is why we're working with Chris Van Gorder from Scripps and all the others, to report. Because remember, this is a business based on compassion. So sometimes they feel bad for their patients and they don't want to report because they don't want to get the patient in trouble. They make excuses for them, but that escalates the behavior. So we're doing cross-training. We're training law enforcement to understand the healthcare perspective, and we're training the healthcare professionals to understand our perspective and what we need from them so we can have a successful outcome.
Can you help us understand why there is a discrepancy between, let's say, being in an airport or an airplane and making a threat versus being in another situation like in a hospital and making a threat, and why they don't have the same kind of consequences? I know we're obviously very sensitive with airplanes for many reasons.
Yeah, that law has been established a long time ago, and I think we weren't thinking or even potentially facing this level of threat in our healthcare institutions. So the law has to always move with the times to protect, to provide the rule of law. And clearly there's a difference. There's even a difference, believe it or not, if a healthcare professional is in the field, like a paramedic responding. If you attack a paramedic, that's a felony. But if you get to an emergency room, that's a misdemeanor, unless you cause great bodily injury. So
Is it California law or federal law?
It's California law. So it is an uphill battle. We've tried once, it didn't go through. We're going to try again now with the better data. I mean, 39 cases in a few months, that by itself should send a strong message that we need better laws.
We just saw a medical professional who died in a case recently, obviously that dentist.
Yes.
Very quickly before we go, there was a cyber attack in November. It disrupted services at Tri-City. What steps are you taking in terms of that cybersecurity threat?
Yeah, we always look at those very seriously to see what happens, working with the FBI, which usually takes the lead on these kind of cybersecurity. But all of the local law enforcement is on the front lines looking at what to do. One really exciting thing San Diego is doing is we just received a very large settlement on a fraud case that we did, and this money is going to go into beefing up our cybersecurity in San Diego. So we are working together with all systems to create better protections for hospitals, especially in other vulnerable locations.
Lots of different kinds of threats we're talking about here: physical, verbal, or like you say, cyber as well.
That's
DA
right.
Summer Stephan, thank you so much for coming in. Appreciate
Thank
the
you.
insight, and best of luck. Keep us updated here with the task force. Thank you.
Thank you.
Thank you so much.